I'm grateful every day. Every day is a gift.
Jim Wilson savors every second, has every day since COVID-19 spread across the country and into his lungs.
I woke up with a cough, and over the next 5 days, the cough got worse and worse until I couldn't breathe or talk.
That was October 2020. A friend drove Jim from his home in Bailey to the ER.
And they put me under, and at that point, they put me on a ventilator. And that was the last thing I remember.
What Jim can't remember, Alexandra Smart can't forget.
Jim was incredibly sick, and we were all struck by how young he was.
Dr. Smart was working at Advent Health Porter when Jim was flown in and put on ECMO. ECMO can keep you alive by doing the work for your heart and lungs. Machines in short supply during the pandemic's peak. Every day, Jim's ECMO tech, Paul, kept watch.
His disease progressed to where he was on full life support, full ECMO support, and there was a lot of days I came into work where he just kept getting worse and worse, and was genuinely worried.
Even though he wasn't, conscious through a lot of it, he was clearly fighting very hard.
I died a dozen times or so. There was discussions with my family, he's probably not going to make it, blah, 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 those kind of things. And also due to the limited number of the machines, there was other patients coming in that might have benefited more by, putting them on the ECMO machine. Which means in a sense unplugging me.
I didn't know if he was going to make it till the next day, and he did. He'd be there the next day.
Jim was on ECMO for 68 days. Recovery would take even longer.
I was completely incapacitated. They were able to weigh me. By that time I had lost 60 pounds, so I couldn't even raise my arms or anything.
Slowly, his strength returned. And 4 months after entering hospital care, Jim headed home to Bailey. In time, returning to racing and dirt biking, the things he loves. Still, a return to normal seems far off.
If I push myself too hard, my heart rate gets too high, then my heart and lungs can't keep up with getting the rest of my body oxygen. And I kind of hit that wall. My pulmonary functions is just over 60%. I kind of plateaued at that. So I have permanent scarring and fibrosis in my lungs.
So he travels down 285 every week for checkups, testing, and to see the staff that saved his life.
I see Jim quite a bit.
He doesn't remember the 68 days that I was here, but that's okay. And it's just amazing. Every time I see him, I can't help but smile.
I have so much gratitude for what they did for me. They feel like family to me.
4 years into that second chance at life, Jim now makes gratitude a goal. Every day, finding reasons to give thanks for his health, for his caregivers, for every day he didn't expect to have.
I mean, there's no guarantee for tomorrow. It can all be gone. So, and I took it for granted before all that happened.
That was Rachel Krause reporting. Jim has become close over the years with both Dr. Smart and Paul. Paul bonded with Jim's family even while he was still in the hospital over his love of cars. Now that he's recovered, he and Paul go to car shows all the time together to show their cars. Both of them say they're grateful for the bonds they've built through a time of so much pain.